Well, good morning. It's good to see you as always. Thank you so much for joining us. This is my doctor, and my name is Winnie Lubemir. Of course, today we want to discuss something a little bit lighter, but very, very important for us to understand, and that is the third trimester. And you know what? When you've reached the third trimester, of course, you're in the home stretch in your pregnancy, and you've got only a few more weeks to go, but this part of your pregnancy can be the most challenging, and of course, also, the first trimester. But today we want to focus mostly on the third trimester. So you know the drill by now. If you have any question, we're live. So that means you can call in any time with your question in regards to the third trimester. And of course, we'll be more than glad to answer all your questions. My guest is here. So 0791478990 is the number to call through, or send us a text message on 40920. We'll be looking at your questions in just a bit. But for now, let's meet our guest for the day. Good morning.
Good morning.
Thank you so much for joining us. Actually, it's not raining today, because I was about to say thank you for bracing the rain.
Yes.
But thanks for coming, today. Before we get into the discussion, can you say hi to the people? Because you've been lost for a while.
Yes, my name is Matthias Odera Akech. I teach at Jomo Kenyatta University of Agriculture and Technology in the College of Health Sciences.
All right.
Yes.
Karibu sana. Now, you know, the third trimester, I think just pregnancy as a whole is a journey. We all know that. And for other people, it's easier, but for other people, it's never, never easy. Some people have like very difficult pregnancies throughout. So can we just talk about the aspect of it being, and there's some people who having it easier, others just having it like very, very rough pregnancies throughout, and then we'll focus mostly on the third trimester.
Yes. Normally, pregnancy is divided into, the journey is divided into three sections.
All right.
And these are not just distinct parts, but it's because there are certain things that happen the first 3 months, the next 3 months, and the last 3 months. Now, it is those 3 months that are called trimesters. So we have the first trimester, the second trimester, and the third trimester. Now, there are complications that do arise in the first trimester and complications that do arise in the second trimester, and others that are confined to the third trimester.
All right.
Yes.
So, and can we just go through very briefly the first complications that might arise during the first trimester and second trimester, very, very briefly, because our focus today is on third trimester.
Yes, in the first trimester, the most important thing that may happen is bleeding.
Okay.
That could be due to a miscarriage, or it could be due to ectopic pregnancy, or sometimes many women have nausea and vomiting, and sometimes some do have infections. Now, in the second trimester, this is the time when we say that the one is likely to have most of those complications like vomiting or bleeding tend to subside. So it tends to be quite smooth in the second trimester until the third trimester, when other things do arise.
Usually happens. All right, and for those of us, I mean, like you said, it's divided, the whole journey is divided into into 3 stages, I would say, and that is the first, second, and third. So then I think just for the basics, I know most of us might know this, but some others, and that is the question of then when does the third trimester begin?
Well, the third trimester begins from the 28th week up to the 42nd week.
Okay.
But nowadays, we are stretching science more such that somebody who has certain complications that would not be taken as complications of the second trimester, but they occur after 24 weeks onwards.
All right.
Up to the 42nd week, they are normally lumped together. This is because babies who are born at 24 weeks onwards tend to, some of them do survive. So nowadays, we stretch it up to 24 weeks.
24 weeks.
So because if somebody is born at 24 weeks or 25 weeks, a good number of them may survive, even though with some problems.
All right.
Yes.
Okay. And those are those the ones that we call preterm babies?
Yes,
Or
preterm
preterm
babies.
babies.
Preterm
Okay.
babies,
So
yes.
24 weeks all the way to around 42.
42nd week.
42nd week. Okay. So then can we talk about the fetal development? Because I mean, the baby has pretty much developed by the time they hit the 3rd trimester. So what are some of the things that, let's say, or just talk about the fetal development during this particular trimester? What are some of the changes that happen in the baby?
Well, by the time the baby reaches about 8 weeks, from 8 weeks onwards, most of the organs are formed.
Already formed.
Already formed.
Okay.
It's just a question of them developing further.
All right.
And they differentiate, that is, they acquire their functions from then onwards. Then from the 2nd trimester onwards is a question of increasing weight and further development. But in terms of structures, everything is formed in the 1st trimester.
Okay.
Yes.
And before I lose this, because there's some things that Lisa would want us to focus on, and that is the bones, the hair, the nails, the skin, you know, the digestive system again, and, you know, the 5 senses and the brain, because pretty much have developed during the 1st and 2nd trimester. So this is more on the strengthening and just getting into form before the baby comes out. So for the weight, what is the ideal weight that, let's say, the baby is supposed to gain by the time they reach the 3rd trimester?
Well, at 28 weeks, the baby should weigh about 1 kilogram.
All right.
And at the time of the baby, at the time of birth, majority of the babies that are born in this country weigh on average 3.3.
Okay.
But anything between 2.5 and 4 kilograms is regarded as normal.
All right.
But on average, 3.3. Yes.
Because we see a lot of, I mean, so many babies, the ones, let's say that I know, most of them were born at 2.4, 2.5, onwards until around 2.8 over there. But this is more on the normal range. Well,
we don't talk about the weight as a sign of maturity, because sometimes a baby may be born at 28 weeks or at 30 weeks or even 38 weeks, but the weight is less due to other problems. So what is important is that the gestation at which that baby is born. But babies born at a weight of less than 1.9, these are babies who need special care and have to be taken to the nursery. But anything beyond 1.9 onwards, these are babies who may not necessarily need a special care.
Special care, yeah.
Yes.
All right. Okay, and for the senses, and this is where it gets interesting, because people say that a baby, of course, at this time has been bonding with the mother, so the baby knows when, let's say, the mother is in a good mood or when they're not in a good mood, and when the mom wants the baby to play or not. I mean, all those things. Can we just talk about then the 5 senses that the baby develops at this particular stage?
Yes, babies do sense, and some babies even dance to music.
Yes.
They play when music is being played. When it comes, some of them even have tastes. Yes, they have taste senses. The actual age or gestation at which this develops is arbitrary. It's not because you can't you can't do an experiment with the baby to find out when it actually develop. But it is true, yes, they sense. If the mother is emotionally disturbed, they will sense. If music is played, they will sense. Yes.
Okay. What about the brain? Is the brain like fully developed at this point, or are there things that, let's say, are still developing even during the 3rd trimester?
The brain continues to develop even after
birth.
After birth.
Yes.
So it's just a question of which functions do develop at what particular time. But the first 2 years, even after birth, the brain continues to develop. Yes.
Yeah. All right. And then can we talk about, because again, this comes about when the baby is about to be born, where they will tell you, oh, the baby has not turned, southwards. So then when are they supposed to turn southwards?
Well, before the 3rd trimester, a baby can face any direction. can be, the head may be found up here, can be on the sides, or can be found down. It can face anywhere. But in most cases, the baby turns to face downwards in the third trimester, majority of them. The ones who persist to stay with the head up after about 36 weeks, they are likely to remain so. But we don't consider that as important unless the mother has reached term and the baby has not turned.
Okay.
Yes.
What could that mean then? I mean, if the baby has not turned, and like you said, if it's 36 weeks and the baby has not turned downwards, then they're likely to stay there. Why? Is it because there's no space where they can turn, or what usually happens?
Well, what happens is that the uppermost part of the uterus is the biggest.
Oh, yeah.
And therefore, it is the part of the uterus or the womb that can accommodate the larger parts, the legs and the buttocks. Well, the head is small. So that's why they face downwards. But sometimes if there's a problem, either the uterus is laxed, or if the uterus has got masses, like some tumors, or if there's something like a placenta down on the lower part of the uterus, then that may hinder the turning, such that you have a baby that the head persistently occupies the upper part. The other thing is that babies, if somebody has multiple pregnancies, then that also reduces the space.
Oh, yeah.
Also, babies who have congenital abnormalities, like the ones who have whose heads are enlarged, what we call in the medical term hydrocephalus, those ones also, they tend to have to stay in the womb with the head upwards. Yes.
Yeah. Is that risky? And especially, let's say there are no issues, I mean, there are no cases of, congenital abnormalities, it's just that the baby has decided, I want to stay up here and not turn down there, I mean, or face downwards. Is it risky for both the baby and the mother, or it's something that can still be delivered, let's say, in a different way as other than the natural way?
Yes. Normally, if a baby faces for example, sideways, where the head is on either side, the problem will come when she breaks the waters. One of the things
when the mother breaks the waters.
Yes.
Okay.
One of the things that may happen is that the cord may be the first one to come out.
To come out. Yeah.
And when a cord comes out, that's an obstetric emergency. The other thing that may happen is that if she continues to labor with the head across,
on the sides,
there's no way that baby is going to be born. And if the uterus contracts and it is neglected, then the ultimate thing is that the uterus is going to rupture. Now, that is when it is facing sideways.
On the sides, yeah.
Now, when the baby faces upwards, that is, the baby comes with the legs first. Normally, the head of the baby, when the cervix dilates and the legs are facing downwards, the legs may pass through a cervix that is not fully opened because the head of the baby is the largest part. So one of the things that may happen is that the legs and the body may come out. Then the head gets trapped inside and with the cord outside.
Yeah.
So now that is also an obstetric emergency.
Yeah.
But sometimes if, for example, that does not happen, the cervix is fully opened, one of the things that may happen is that there are maneuvers to deliver such babies, but they may leave the baby with certain problems because there could be trauma when one is trying to maneuver and deliver the baby. So as much as we teach that you need to look at the baby, look at the mother, then decide whether you're going to deliver a baby who is coming with the legs first, normally, the dangers associated with such kind of deliveries are enormous.
Yeah.
I don't do it because once the legs have come, the head is trapped inside,
Yeah.
then everybody starts sweating in the delivery room.
Yeah.
So it's a scenario which can end up with the baby dying. And again, even if you deliver because of those maneuvers, the mother may be left with the infections. So it's something that in good practice, you shouldn't try.
Yeah. So are there things then that you can do to help? Let's say the baby has not turned yet, and again, this is a case of there are no cases of congenital abnormalities. It's just that, well, the baby didn't turn as expected by a particular time, and that is during the third trimester, especially when they are about to be born, when they are due. So then, are there things that can be done to sort of help the baby to turn?
Yes, there are things that can be done.
All right.
Like one can turn the head to face downwards. But that also is associated with certain problems. There are certain risks that accompany such maneuvers. Like, for example, somebody can can separate the placenta from the uterus, or you can turn the whole uterus. Okay, and
That sounds painful.
yes, no, it's been done well.
It's done professionally. Okay,
yes.
all right, okay.
But because of those risks,
Yeah.
many people are shying away from. If you can do a cesarean section, then one will shy away from turning the baby.
Yeah.
But if one is in a place where cesarean section is not possible, then that's one thing that somebody can try.
Okay, because I remember, I mean, and I've had stories of, let's say, women who are not able to go to a hospital, so they depend on the traditional birth attendants to help them in turning the baby. And the stories are a little bit scary, but it's okay. I mean, whatever they do to help the baby, as long as the baby comes out the right way, you gotta do what you gotta do. So, can we talk about then, are there cases where, let's say the baby has turned, everything concerning the baby is okay and is normal and is as expected. But are there instances where then the mother, let's say, and this is during that time where, of course, they are due, the mother is sort of not ready. I don't know if that makes sense, but the mother is not yet ready to deliver the baby, in that, let's say, the cervix has not dilated as it's supposed to, or any other thing that can happen?
Well, there are a few things that may happen in the last stretch of pregnancy. And just before we reach labor, one of the things that may happen in the third trimester is breaking the waters. The waters may break.
At what point is it supposed to break, though? Is it when they are about to go into labor, or it's way before?
Well, the waters are supposed to break, and once it breaks, it should take less than 1 hour, and the woman should go into labor.
Oh, wow. Okay.
Anything that happens, any breakage that happens 1 hour before labor, or when the baby is immature, is abnormal.
Okay.
Yes. But sometimes I normally tell people that one should not wait for the waters to break, because sometimes it breaks when the baby is just about to be born. Yeah, so one of the things that may happen is the breakage of the waters. The other thing that may happen is bleeding before delivery. Or sometimes they may develop high blood pressure. Or sometimes the baby may not be growing at the rate that is expected. What you find that when one assesses the height of the uterus, finds that it is smaller than the expected duration of pregnancy. Or sometimes the other thing that may happen is the mothers may develop swelling of the eyes or severe throbbing headache, which is a sign of blood pressure increasing.
All right.
Now, to go into what may happen what may happen before delivery. What was the question?
Those cases where, let's say, the baby is ready to come out, but the mother is not yet. Like, let's say the body is not ready. Let's say the cervix is not dilated as it's supposed to. Do we have such cases where the baby is ready, but the mother is not?
The baby will not tell you that I'm ready.
Okay. No. Like, the baby has turned. Like, everything that's, let's say, a baby is sort of expected to, or the position that the baby is expected to be at a particular time, especially when they are about to be born, they are in that position. But now, let's say the mother's body is sort of lagging behind.
Okay.
Yeah.
What normally happens is that it is not the turning of the baby that determines whether the baby is ready or not.
Or not, yeah.
What we use to determine whether a baby is ready to be born or not is the duration of the pregnancy.
Oh, the pregnancy, okay.
We should take about 42 weeks. So if a baby stays in the womb for more than 42 weeks, then we know that baby is ready, but is not coming out, or the mother is not going into labor.
Yeah.
So it is the duration of the pregnancy that determines whether baby is ready or not.
Or not, okay.
And if we are unable to calculate the exact duration, then we use ultrasound to assess the age of the baby, whether the baby is at term or not.
Or not, okay.
Then we can also take some fluid from the womb to assess whether the lungs are mature or not. Now, if those ones are fulfilled, then we say that the baby is ready to be born, but the mother is not going into labor.
Okay.
Then we decide that it is pointless to continue with the pregnancy when the time for delivery has reached, because of the complications that do arise. Then we do induce labor.
Induce labor,
yes.
Okay. But what if someone is not, and are the women given this option? Because there's some people who fear induced labor. It's pretty much intense as compared to just going into labor naturally. So are they given options? Because a mother might be like, let me wait a little longer. Let me wait a little longer. So are they given that option? Oh, well, you can wait a little longer. But if it doesn't happen by, let's say, this particular time, then we have no choice but to induce you.
Yes, we normally explain the pros and cons of a continuation of a pregnancy beyond 42 weeks.
All right. Okay.
So it is not that something that one is going to be forced. We are going to tell you, your baby has passed the due date, and therefore, because of 1, 2, 3, we intend or we advise that we induce labor.
Labor, yeah.
Yes, some do object to that, but as long as they have understood exactly what it means to them and to the baby, then we don't force anybody.
Okay.
Yes.
All right. And then cases of delayed labor, because again, like you said a little bit earlier, that this could happen. Do we know why? Why sometimes a mother is supposed to go into labor by, let's say, a particular time, and then they don't?
Well, we do not know the exact reason why some women deliver at 38 weeks, some will deliver at 42 weeks. Yeah. But also what we know is that not everybody knows exactly when they lastly got their monthly period.
Oh, yeah. Okay.
And we can also not time exactly when they conceived. So this is an average kind of thing.
All right.
So if somebody goes, what is known is that any pregnancy going beyond 42 weeks is not right.
It's not right, yeah.
Any pregnancy being delivered before 38 weeks is not right. So on average, 38 to 42 is good. But why others will go into labor at 39 weeks, others will delay up to 41 weeks is not very well known.
Yeah. Okay. It just, some things you can't really explain. Okay. So then, can we talk about very, very briefly, because we're about to go on a break any time from now, but we focus more on the complications. What could happen if this is not happening at, let's say, this particular time? Then can we talk about the positives? The positives being some of the changes that are expected for the mother, especially in the third trimester, whether physical or emotional or any change that, let's say, a woman probably watching us and they're pregnant, let's say in the first trimester or second trimester, would want to know as far as third trimester is concerned?
Yes, some of the things that may happen during the, that do happen during the third trimester is weight gain. Now, the weight gain, and also they may also feel tired and backache. And some of them also don't get adequate sleep because they don't get the correct position to sleep. And then even when they sleep, because the uterus, the womb, is pressing on the bladder, they may find that they are waking up many times
To use the bathroom.
to go past urine. Now, that also interferes with their sleep. So at the end of the day, when they wake up in the morning, somebody has not rested, so they are tired. But these are normal things.
Yeah.
The other thing that may happen is that one may find that in the third trimester, because the womb is pressing on the stomach, the capacity, the volume of the stomach reduces. So they may find that they are eating small portions of food. Okay, they get full on very small portions of food, and get hungry so fast.
Faster.
Yes. So this is also normal. They may also feel heartburn because when the food stays in the stomach for some time, they may get a reflux. Yes. So that is normal.
Okay.
Yes.
All right. And of course, we also have, you talked about an aspect of them getting hungry quickly and of course tend to eat, more often. So what is the expected weight gain? Very, very briefly.
About 1 kilogram.
About 1 kilogram.
Sorry, 0.5 kg per week.
Per week.
Yes.
Okay. All right. So let's take that short break. But of course, when we come back, then we can talk about aspects of swelling as well. Is it normal? Is it not? Because again, remember in cases of preeclampsia, and then Braxton Hicks, and of course we talked about heartburn, which is okay, and bleeding. I think we mentioned that a little earlier. So if you have any question, remember we're live. So that means you can call in any time with your question, and of course we're here to answer them. The number to call through is 0791 478990, or send us a text message on 40920. We'll be looking at your questions after this very short commercial break. Stay with us. All right, welcome back. Glad you're still with us. This is My Doctor, and of course, if you're joining us right now, our focus today is on third trimester. We're just looking at some of the changes that happen during the third trimester, what to expect. And let's say if you're pregnant watching us right now, it's very, very important for you to know what are the things that are expected to happen, the body changes, either physically or emotionally, during the third trimester. So if you have any question, remember, we are live. So that means you can call in anytime with your question, or 0791 478990 is the number to call through, or send us a text message on 40920, and we'll be looking at them in just a while. But for now, we were talking about the different changes that a woman, goes through when they get to the third trimester, and most of them are tired. By this time, most of them, when you talk to them and tell you, I'm ready to deliver this baby because I am tired. So we were talking about the different changes, but now for the swelling, is it normal or is it not? Or what's considered normal and what's considered not normal?
Yes, the swelling that is confined just to the lower limbs could be normal or abnormal.
Okay.
But the swelling that is experienced on the upper part of the body could be on the eyes, on the whole body. That is abnormal. Now, if one has a swelling on the lower limbs, on the legs, and the blood pressure is normal, the kidneys are functioning normally,
as they're supposed to.
then that is normal.
All right.
A normal finding in pregnancy. But if there is increased blood pressure or there's abnormal functions of the kidney or of the liver, then that is abnormal. So if one has swelling of the lower limbs, it is important to visit a doctor to ascertain whether the kidneys are functioning well, whether they have high blood pressure, or whether their livers are functioning well. If those ones are fine, it's a normal thing in pregnancy. But a swelling of the eyes or of the body, I mean, generalized body swelling, that is abnormal. And when one has it, there must be a problem. So it is important that they are seen as soon as possible.
Okay.
Yes.
And how soon can that be? Can it be picked, the abnormality? How soon can it be picked? Because you see, I mean, we've seen women, so many of them, you know, especially when they're pregnant, cases of, you know, swelling on the feet, and we all consider it normal. I mean, because like you said, sometimes their blood pressure might be normal according to them, and they do not feel pain anywhere, it's just the swelling. So then one might assume that, well, this is normal, this is expected during pregnancy, and especially during the 3rd trimester. But then again, when can then the cases of the abnormality be picked?
One may not tell for sure that you have high blood pressure, because we say that high blood pressure is a silent killer. So instead of assuming that everything is fine, you rather go to the hospital to be checked and let the doctor confirm that everything is fine. Because if one is waiting to develop the signs or the complications of high blood pressure, then the complications may be a fit and a death. So instead of waiting for those complications, or high blood pressure may also cause bleeding, or the high blood pressure may also cause the baby to die. So instead of waiting for those complications that may make you feel that, oh, I have this, then it is better to go to the hospital and let you. It doesn't take much. One can even go to a chemist, have the blood pressure checked, and if it is normal, yes, you can take it as normal.
Okay.
But one should not wait and say and assume that since most of the people have swelling of the legs, mine is also normal.
It's normal. Okay.
Yes.
All right. And then so there's that aspect of then the Braxton Hicks again. So is this normal or no?
Well, the uterus normally contracts. The womb normally contracts during pregnancy, and this starts even from the 2nd trimester. Now, the contractions that come at irregular intervals, that do not progress, that do not increase in intensity, are the ones that are referred to as Braxton Hicks contractions. But contractions that progress, that come at regular intervals, must be checked, because they could be a sign of premature labor. Yes.
So then, okay, so what is one supposed to do, especially when they have, because you see, and especially for the first-time mother who doesn't know that, oh, well, these are just Braxton Hicks, or this is the actual labor. What would you tell them, so that it's very, very important for them to also monitor?
Yes. The Braxton Hicks, one may feel 2-3 in a day.
Okay.
And they are widely spaced.
Yeah.
Okay? But the contractions of labor, once they've started, they progress in intensity.
All right.
The intervals in between those contractions also tend to decrease. And once they've started, they don't stop.
Okay.
The Braxton Hicks, one may feel in the morning, a baby in the afternoon. That is not labor. But if one gets contractions that are painful, some of them may or may not go to the back. Okay? And may or not be associated with some bloody discharge. Then that could be, even if one is remote from term, could be a sign that one is going into premature labor.
So do you check yourself into a hospital as soon as, let's say, you start feeling the contractions, or what do you do? And especially if they are Braxton Hicks, do you check yourself to a hospital?
Well, Braxton Hicks, you don't need to
You
check
don't
into,
need to.
into
Okay.
hospital because if you failed contractions at 10 a.m., another one comes at 2 p.m., another one in the evening, I mean, those are not the contractions of labor. But if they are consistent, they are persistent, they're increasing in intensity, they're coming at shorter intervals, then one needs to check into hospital for the health workers to ascertain whether the cervix is opening or not.
Okay. All right. And then just to answer a question here, this one says, hi, I'm in my second trimester and I'm experiencing bacterial infections in my vagina. Is it normal? Because I have taken medication, but still it comes back. Infections.
I don't think it is, I don't think it is bacterial infection.
Okay.
The most common problem that is recurrent in pregnancy is yeast infections. Yes, and if she's being given an antibiotics for the bacterial infections, then it is getting it says being made worse.
Okay.
Yes, so one needs to be checked, and there are two things that do happen in pregnancy. One can get a yeast infection, candidiasis, or one can get a vaginosis. The treatment for either of them is different. But if one goes to a hospital and is told that you are having a bacterial infection and is at discharge without knowing exactly what it is, and you're given antibiotics, then it may make even the discharge worse.
Yeah.
Yes.
So what does she need to do? I mean, go back to a hospital and just get them or get checked like properly?
The problem the problem we have in this country is what we call hospitals. Yes, because because so one may go to a private facility being manned by somebody who does not know.
All right.
And you're being pumped with antibiotics, which are just making the condition worse.
Worse, yeah.
So the best is to go to a reputable hospital. Yes.
Oh, there's a difference. Okay. Difference between just a hospital and a reputable hospital. Okay, got it. And then this was this other question, where is it normal to secrete milk from the breast prior to delivery?
Yes.
Okay.
Milk production starts around 14 weeks, and it is stored in the breast, and it is normal towards the end of the pregnancy for one to secrete milk, and sometimes even during intimacy, you may find that milk is coming out.
Oh yeah.
And that is perfectly normal.
It's normal.
Yes. So.
Okay. All right. So, okay. And then, so in terms of then the exercise, because you see at this point, one is tired and you know, all those things. So before we even talk about the exercise, then the cases of milk, because you see, fine, as soon as one gets pregnant, of course, there are changes that would happen. And of course, one of them is then milk production, which gets ready or prepares itself for the baby. But why is it that after the baby is born, some women have issues? They'll tell you, man, me, I don't have milk. I do not have milk to feed the baby. And there's this other one who has a lot of milk. So why is that? Because you see, during the pregnancy, of course, there's that formation and all those things. But then after the baby has come, there's no milk.
Yes, the problems that are associated with less milk is mainly because of our behavior. One, the milk production, synthesis and secretion depends on how early one puts the baby to the breast after delivery.
All right.
So the earlier one puts the baby to the breast after delivery, the better. The other problem is we also practice what we call timed feeding, not feeding on demand. Or sometimes if the mother is separated for long duration of time, either because the baby is unwell or the mother is unwell, that may also interfere with the milk supply. Milk production.
All right.
Yes.
So then how early is early in terms of introducing the baby to the breast after they are born?
Within the first hour.
Okay. All right.
Yes.
Okay.
Soon after delivery, in fact, soon after delivery, if the baby is stable, the mother is stable, within the first hour, the baby should be put on the breast.
Okay. But at this point, most women would say it's painful. It's very, very painful. So they would rather not and wait a little longer.
I don't think it is painful.
Okay.
The pain that comes
Yeah.
with breastfeeding
Uh-huh.
comes as a result of poor latching. That is something that happens later. But as soon as the baby is born, there's nothing to make those breasts to be painful.
To be painful.
So if you put the baby on the breast and it has never been, the baby has never sucked the breast, it's unlikely to be painful.
Okay.
Yes.
All right. Now, so then in terms of the exercise, I mean, how much exercise is one supposed to do during this particular trimester? Because like we said, most women by the third trimester are tired, and most of them would just prefer to rest as compared to even be active or to do exercise. So in terms of the exercises, are there exercises that are recommended for one to do during this third trimester?
Well, exercises are recommended, but one has to check with their doctor first.
All right.
Because there are certain conditions where doing exercises will not be advised. And if your doctor ascertains that there is no complication, then one can do exercises.
Okay.
And the safe ones that somebody can do that is also cheap is walking. Yes? Walking, I mean, if one walks a total of 30 minutes every day or 3 times a day, 3 times a week, is fair enough. The other one that one can do without necessarily getting complications is swimming. I mean, in a swimming pool, not in the river.
Yeah.
So those ones are things that somebody can do. And one can also, even if you sit down, lifting your legs up and down, those are exercises. Yeah. So, but exercises that demand impact, where one can lose balance, are normally not advised because she's unstable. She's likely. Some of them may lose balance and fall. But before any exercise, it is better to check with the doctor first.
Yeah, because we hear so many cases of women who exercise. I mean, they were exercising before they got pregnant, and then they continue to exercise even during pregnancy. Even during the third trimester, one is still exercising. So, but like you said, they need to monitor what sorts of exercises they are doing. Now, still on the exercise, I heard that there's some exercises that one can do to, one, reduce the intensity of the labor, and 2, to make the baby come out faster. So not labor for long, like 72 hours or for 4 days and all those things. Is that true?
Well, there are certain exercises that increase the blood supply to the pelvic muscles so that one will be able to the pelvic muscles will be able to have blood. But in terms of reducing the duration of labor, the exercise that will reduce the duration of labor, I'm yet to find out.
Okay.
Yes.
So which ones then help with the pelvic muscles?
Normally, there are those exercises that we use, we advise people to tighten the pelvic muscles. What we say is that assume you're in a meeting and you are pressed with urine, you want to go past urine, and you can't go past urine. What do?
Yeah.
Now do like that
Okay.
when you are sitting down.
Okay.
Yes. Whether you are eating, whether you are doing anything, those pelvic exercises, they call them Kegels exercises. Yes.
Okay. Oh yeah, so one can do that. Okay. And what about the food? Because again, I had that, and especially for the pineapple, it helps pineapple. It helps with the labor as well, either to help the baby come out fast or reduce the intensity. I can't remember well, but yeah, so you'd find most pregnant women taking a lot of pineapples during the third trimester. Is there any connection to it, or no? Well,
I've not seen where pineapples have been tested and found out that it reduces the duration of labor. But if somebody has done it, then it needs to be, do it in 100 women and find out what, because one may just have one case, but that does not mean that it applies to everybody.
It happens. All right, okay. So then can we talk about then nutrition and how important it is for one to just monitor what they're eating at this particular stage?
Well, as I said before, that one is unlikely to eat enough food
Yeah.
in one sitting when in the third trimester. So it is important that at this particular time, one eats small portions of food, but more frequently.
All right.
And the foods that one should eat are just the normal foods, but it's advisable that you increase your protein intake and reduce on the sweet foods, the sugars, okay? Because of the constipation that occur during a pregnancy, one is also advised to eat plenty of fruits and vegetables, okay, and take enough water.
Okay.
Yes.
Why reduce the sugary foods and increase the protein?
Well, the baby is developing. The baby is laying down proteins in the body, so the demand for proteins are high.
Okay.
Now, the sugars, if one takes them, then what will happen is that the body will convert them. If you take excess, the body is going to convert them into fat. So instead, you'll just be getting fat, but not giving the baby what the baby needs.
Yeah.
Yes.
Okay. So then, fine. So all those things, the different changes, and probably we've addressed, of course, cases to do with some of the complications that might arise and all those things. Can you talk about the birth plan and why is it important to have a birth plan?
Yes. It pains sometimes when you see a mother coming to delivery room, like she has just appeared, nothing. Because delivery doesn't take place suddenly. It is important that somebody plans where to go give birth, how to reach there, who to accompany them, and what to carry.
Okay.
If it is a public facility, as much as we know this free maternity, I know there are hospitals that still demand certain things that mothers have to carry. One has to find out in this hospital or this health facility where I'm going to deliver, what are the requirements? What do they ask people to come with? Some people ask them to come with cotton wool. I've heard certain places they ask to go with water.
So go with water?
Yes.
Oh, wow. Okay.
So it depends on the hospital or the health facility that somebody is going to use. But it is important to identify the place. That's important. Number two is to find out how one is going to reach that place. And one has to work with the worst case scenario. Will I be able to get to that hospital at 3 a.m.? Yes, because labor sometimes, most cases, starts at night. Yes, so you ask yourself, will I be able to reach there at 3 a.m.? And if, for example, one is in the rural areas and you want to deliver in a certain hospital, then one can identify even a relative to go stay with so that you are nearer the hospital
to the facility,
rather than having to walk several kilometers to reach the hospital. The other thing is that one also has to find out in that hospital where I'm going to deliver, are there certain charges? And if there are charges, what are those charges? Okay? And one has to work with a worst case scenario, an operation.
Yeah.
Yes, if it ends up with a cesarean section, will I be able to afford? So finances are important. And also it is important to know who is going to take you there. Yeah. How you are going to reach there.
To reach there,
yes.
Yeah. And even the doctor who's going to attend to you as well?
Or well, for the private hospitals, that is important.
Okay.
Yes.
Oh, yeah.
And how much will charge you?
Oh, yeah. Okay. All right. So as we're finished, because, again, we need to end the show like anytime. I mean, now, in the next like 1 minute or so. So just to summarize what we've discussed, and especially the do's and don'ts as far as the third trimester is concerned, what would you say? And I think I'll take that as your parting shot. Yes.
One of the things that one has to be on the lookout for in the third trimester is any development of fever, any bleeding, a baby not playing well, if one breaks the waters, or if one develops swelling of the eyes or severe throbbing headache,
Okay.
or more importantly, if the baby stops to play the way the baby has been playing.
Okay.
Yes.
All right. So thank you so much for coming by today, Dr. Okesh. Really, really appreciate your time. Just to help us understand what usually happens during the third trimester, because like you said, and especially for the birth plan, most of the time we don't really put into consideration so many things. So thank you for giving us an insight on this. And thank you so much for staying with us as well until the end of the show. We believe that you've learned a lot as far as third trimester is concerned. My name is Winnie Lubembe. On behalf of an amazing team who put together the show, we wish you a lovely day ahead. See you next week on Monday, same time, same place. But for now, have yourselves a good one. Goodbye for now.